Fractured human phallus injury. Image 1. Phallus fracture. The arrow in image A is at the fracture point of the injury. Note the areas of deep tissue injury in images B, C, and D. Definition of terms. Ecchymosis refers to a small bruise resulting from blood vessel leakage into skin or mucous membrane tissue. Fistula. Abnormal or surgical passage between a hollow or tubular organ and the surface of the body or between two such structural organs. Fracture. The breaking of a body part. Tunica. A membrane or other structural covering or lining of a bodily part or organ. The tunica albuginea of the corpus cavernosum. The dense fibroelastic white sheath enclosing both corpora cavernosum, composed of longitudinal superficial fibers forming a tunic around them, as well as deep circular fibers along its course, separately surrounding them, coming together in the middle, forming the phallic septum. Corpus cavernosum. The cavernous column of tumescent tissue forming the dorsal and side of the phallus, containing vessels that fill with blood, resulting in tumescence. Corpus spongiosum. The spongy tumescent tissue column in the shaft and the glands of the phallus, surrounding the tubal urethral surface of the phallus, containing vessels that fill with blood, resulting in tumescence and maintaining the urethra open during same. Its distal expansion point during tumescence forms the glans portion of the phallus. The urethra is also referred to as the spongy urethra. The urinary meatus is the external urethral opening to the outside of the body. Buck's fascia is a deep fascia layer covering the corpora in distinct fascial compartments of the phallus. Image 2. Lateral cross-section. The organ of copulation and urinary excretion consisting of the radix root, corpus body, and the glans extremity of the male phallus. Fracture results from excessive trauma related to intimate acts, self-pleasuring, contrived potentially injurious actions, blunt force accidents, or secondary due to the use of vacuum enlargement or other such devices, as well as phallus rings. Fracture consists of the traumatic rupture of the relatively thinner tunica albuginea of the phallus. It generally occurs when the corpora are engorged with blood and actively buckle under force, with an accompanying popping sensation from the pressure of blunt trauma that occurs. Immediate detumescence, severe pain, acute swelling, and deformity result. Since the phallus has no osseous structures, fracture does not involve broken bones. It consists of the aforementioned traumatized soft tissue being injured. Swelling, discoloration secondary to hematoma with an aubergine sign appearance, deviation to the opposite side of the lesion, and a palpable firm stationary hematoma of the shaft occur. The rolling over a skin upon examination and the visible rolling sign obviating a palpable firm and immobile hematoma under the rolled over skin is also diagnostic. Painful dysuria, urinary retention, and gross hematuria may be observed. Swelling of the testicular sac, suprapubic region, and perineum secondary to the hematoma extravasation external to the Buck's fascia, as well as a perineal butterfly-shaped hematoma, are indicative of urethral injury. Urinalysis uncovering microscopic hematuria is indicative of not readily apparent urethral injury. Surgical repair involves skin deglovement to the base for hematoma evacuation, as well as repair of torn soft tissue and ruptured vasculature and suspensory ligaments, and necessary tissue debridement under anesthesia. The temporary insertion of a urethral catheter for efficient urine voiding is utilized dictated by the degree of trauma and urethral involvement. Pain and infection management medication is indicated. Postoperative abstinence is indicated for around 4 to 8 weeks. Surveillance for the phallic curvature characteristic of Peyronie's disease, as well as dysfunctional tumescence, is necessary. Additional complications include painful tumescence and copulation, skin necrosis, arteriovenous fistula, urethral cavernous fistula, urethral stricture, abscess formation, infected hematoma, severe phallic angulation, and impotence that are additionally treated upon occurrence in the longer term. Total traumatic phallus avulsion is rare upon genitourinary trauma. Image 3. Fracture of a 32-year-old man. Swollen, ecchymotic, and deviated circumcised phallus. Image 4. Ultrasound of the phallus. Right lateral view. Longitudinal section showing rupture of the tunica albuginea with an adjacent 1.92 centimeter hematoma due to trauma. Image 5. Axial magnetic imaging scan showing left-sided discontinuity of the tunica albuginea, secondary to fracture. More presentations coming soon. Thanks for watching. Thank you, subscribers.